Hello, everyone. Welcome in to another founder story. We've got another amazing story for you today. We've got the incredible Ashley Barrow here from Reassist. Let's just get stuck into this. Ashley, great to see you. Thanks for being here. What is
Wonderful.
Reassist?
Reassist is an artificial intelligence, human-in-the-loop technology that integrates with the electronic health record for coordinated care.
Okay, amazing. So help me, as an immigrant to the US who doesn't really know much about healthcare, tell me a little bit more about what that means. Like, give me a use case. Give me an example of where this would be used.
Absolutely. So let's say you have a loved one with a chronic illness or a family member that is often visiting specialists, and they might have several individuals involved in their case. And a lot of time these clinicians, they may be nurses, social workers, community health workers, doctors, nurse practitioners. As they're coordinating care, what we found is they all work a lot of the times horizontally and in silos. So they have different systems, they have different processes. One person knows some information that another person doesn't know. So what Reassist does is aggregate that information, put a framework around the process, and actually becomes an operational layer for care coordination.
Okay, amazing. So tell me a little bit about the state of the business today. I know you've raised some money. How is the business looking today? Where are you at in the journey?
Absolutely. So most of the money, the funds that we've raised have been all non-dilutive. We've had some strategic partnerships that have invested some money, some time, some expertise. We're in the state of Ohio, so we're backed by the entrepreneurship ecosystem stemming from Cincinnati to Cleveland. We've done some work with some researchers in many different universities. So that's pretty much where we're at. We're trying to bring this to clinical translation. We have some pilots that have been done, and we have one customer that we're commercializing with right now, looking to do more with hospitals, primary care providers.
Okay, amazing. Well, first customer in the door. That's a big step. Congratulations.
Absolutely, yeah.
I'm so curious. I want to hear about where this came from. What was the inspiration for the business? Tell us the story of how this came about.
Absolutely. So, nurse by background, but I've been a caregiver. I've been a caregiver from all of my life. My grandmother, unfortunately, she had diabetes, and what we didn't know was leading to end-stage renal disease. I would oftentimes go be her companion. I was tasked to see if she used the restroom, be a companion, help her with her hair, help my grandfather, assist her in the many ways that she needed to be assisted of. I know that it was always an issue if there was like a sore that came up or something like that. So I would pay close attention to those things. And what I found is that would transition into my nursing career, right? And then also working as a care coordinator. So that's essentially what started this whole journey is me at the age of 4 being very attentive to my elderly grandmother, which unfortunately she passed away at the age of 52.
And so you had that experience growing up. What was it that made you think that there's a problem here that needs to be fixed, that Reassist can solve?
Absolutely. So as I began my nursing career, I realized that what I really loved was the care coordination part of it, actually helping individuals get knowledge of resources, knowing what's available in their community, getting them connected to community-based organizations, researching specialists, and looking at who can actually push this patient along or help this patient along the way. And what I've seen is many wonderful miracles, I would say for myself, where individuals would be really boggled down with a lot of different ideas and not sure what way to go or how to cope with a new disability, dealing with family issues and also medical issues, social issues, and helping them basically combat that with having knowledge of what resources are out there and available for these individuals, getting them connected to the resources, and then actually see them. Like, for example, I'll give you an example of maybe a patient that unfortunately had a car wreck and their life changed in the blink of an eye. Now they're going from like homeowner, married, all these resources, a corporate worker, to now relying on programs and services and in that poverty layer. But guess what? The person's like 40 years old. you can't just institutionalize somebody like that all their life. We have to figure out how to optimize care so these individuals can be productive with their new disability, making sure they have the best specialized equipment, that their insurance is able to help them get to the next level if they need rehab or if they need services at home, having that knowledge to help these individuals. And that's what I love to do. That's what I found a love for, and I love to do it.
Amazing. I love it. Well, I can see the passion coming through. And I get it. I get it now. I feel like for someone like me, an immigrant to the US, trying to get an understanding of the healthcare system, I feel like I'm a baby again because it's just so hard to navigate. And I see people that kind of, maybe they need some sort of like medical help, but they just shy away from it because it's just so confusing. There's so much kind of like chaos there.
Yeah.
And it feels odd that if you need medical assistance that you kind of shy away from it because of, not just issues of insurance, but just the complexity of it. So I get it. You're here to help make things a little bit clearer.
Absolutely. Yes. And especially for those coordinators that are in these systems, whether they be in the hospital systems or if they're at a skilled nursing facility or if they're at a primary care doctor's office, to know those resources off the top of your head. Sometimes there might be upwards of 200 providers that can do the work, or maybe there is a lack of providers and you really need to dig. Sometimes that can take hours for these coordinators to either find the resources, understand exactly what the patient needs, get the patient history. And what we do is aggregate all that information so individuals can have it right there and in seconds able to find things that maybe it would take them half a shift or maybe several hours to do.
I love that. And I love the fact that you are a nurse by training, right? This makes so much sense. Often I feel like the best entrepreneurs have that hands-on experience of the problem, right? Experiencing it growing up and then being in the system and having that realization of this isn't right. This could be much better
Absolutely.
than it currently is. So well, good on you. Good on you for doing it. I love seeing stories like this. So I know that your son has helped you building this out. Tell me a little bit about that.
Yeah, during COVID. So like I told you, my career, case management, clinical liaison work, prided myself on helping people get to the next level so that they would be better off, in their recovery. And during COVID, as a divorced mom, I had to take, a step back significantly because I had children, remote schooling and divorced moms. So I had to take a step back there. And during that time, all I could think of was processes that I learned in the community, processes in the nursing home, processes in the hospital, and just how chaotic sometimes, all these different layers of clinicians and care and processes, insurance, and it can be really confusing to get the smallest thing done. And I was just like, wow, how did I do that off the top of my head? Like I would meet people and I'm like, okay, I know you need X, Y, Z. Let me get that done. I know that these eligibility requirements are needed for that. And I know that this place is only open these hours of the day. So essentially what I did was I took the framework that was in my mind, I put it in a software. And like I said, it was during COVID. So, trying to figure out how to build this software as a nurse and trying to figure out how to protect it and things like that, and just kind of teaching my kids about it. And so then my son kind of picked up on it and he was just like, you know what, Mom, I can build this for you. And he built our first MVP at 11 years old during COVID. He remains our junior architect. He's doing some research on integrations right now. And when I tell you somebody that can navigate a healthcare system and know how to coordinate care on a very high level, it's my son. It's my son. So yes, thank you for bringing that up. It's a very nice story. I love it, love it, love it. Yes.
Me too. I think that's so incredible, right? The challenges that you're facing, like you said, divorced mom, kids, job, and entrepreneur. There's a lot going on there in and of itself. But to actually still be doing all of that and still be inspiring the kids to get involved is awesome, right? Like you can tell. Like just from hearing that story, you can hear like Ashley is a great mum, right? Here she is.
Not only the great mom,
but also like for your son to be like, hey, I can step up, I can help you with that. I think I can do that. I feel like I don't know many kids that would step up to the plate in that way. and want to get stuck in. So if I were wearing a hat, I would take it off to you. What's your son's name?
I appreciate that. His name is Aaron. And I do want to add to that, just like I was a caregiver at 4, he was a caregiver too. And because there's a high acuity of care coming out of institutions, he had to learn very quickly how to take care of a loved one as well. And so he understands what it means to advocate, what it means to try to find different resources, what it means if equipment isn't working correctly. And that's what people depend on to be mobile. So when you talk to him about different processes, he automatically kind of understands that. But again, because he was also a caregiver. So that's what it comes back down to.
Yeah. No, I love that. I love that so much. Well, Aaron, good man. Good man. I love that so much. But also just for his own story, his own life, and where his journey is going to go in terms of, the career that he's going to have, what he's going to do. He's setting himself up so incredibly well.
Thank you.
It's such a competitive world, right? When you're applying for jobs, AI is now running through resumes, trying to find out what makes you stand out. Well,
yeah.
He's a man that's going to stand out because of his history and what he's already built. So that's absolutely incredible.
Thank you.
I love it so much. And for me, I'm gonna share my own opinion, but entrepreneurship should be rooted in family, in my opinion. In a way where you don't harm family, but something that you can do together, because you need all the support you can get in this world.
Absolutely.
So I love that. A junior architect, that's absolutely awesome. I've got a little 18-month-old, and I would love to have him when he's a bit older to get stuck in a similar way, right? Like learn about entrepreneurship, learn about the grind, the
absolutely,
hustle, and what it takes to do that. So that's incredible. I love that.
Thank you.
I don't know. So when you're pitching for investment, do you mention your son?
Yeah, I do. Absolutely.
Yes.
How could I not? He's a part of it. And matter of fact, he's a young inventor. He has a patent. We're pending patent right now. He signed his name on it, just like I signed my name on it. When he was, I think we finished the final piece of it when he was 14. So we're still waiting to hear back, but he's a young inventor. He absolutely deserves to be recognized. He did a wonderful thing. Absolutely.
I love that. I love that so much. Wow. Amazing. Okay. So, tell me a little bit about the challenges that you're facing now. What are the big challenges that you're facing right now?
One of the big challenges I'm facing is, there's a lot going on in care coordination when it comes down to, patients receiving their own data, being able to do what they want with their data. There's a lot going on when it comes to prior authorizations, and also when it comes to provider directories and things like that. So I'm like in the middle of all of that, compiling all that information, aggregating all that information so individuals can move forward very quickly. And my goal is to first do it for the clinicians, but this is also a patient-facing application. So in that standpoint, we are looking to partner with hospital systems, mostly primary care physicians we'd like to partner with, but what we've learned is that a lot of the primary care doctors actually work in the big hospital systems. So those sales cycles are very long, 6 months, a year. It's a lot going on with they're trying to figure out what they're doing with artificial intelligence and the electronic health record. So penetrating these systems takes a very long time. So of course, you're going to need financing when it comes to that. So that's one of the issues there. But that's really, really getting to the customer, understanding them, not just about how, our company makes money, but how do we actually help in clinical workflow? And a lot of that stuff is protected. So a lot of people don't want to share that information. Really, a lot of that is, the information of these systems. That's their right to, their process and stuff, that is there and they own that. So understanding how to get to be better for the customer, it does take a lot of time and research to try to figure that out. So those have been some barriers, but we've overcome them. We're finally starting to overcome them. It's a time where before a lot of this stuff was impossible to have, but because of artificial intelligence and some of the policies coming down from the official healthcare IT, it's available and we're able to do that. So at a time you couldn't scale care coordination, you absolutely can now, and you can save your team tons of time.
Well, I guess you've led me straight on to my next question. So do you have any idea, like how much time can be saved, or I guess one step further than that would be like, what is the like cost savings? Do you know that?
Millions for, I think we did a view of that, and it looked like about $14 million per system, just by using our technology, and then also the process in the clinical workflow. Within the clinical workflow, it can be about $14 million in savings, but we can also help you make money by making sure we are being code compliant to some billing codes that are available to your hospitals. A lot of the hospitals and health systems don't use them because they're kind of hard to bill, but we found a way to bill them. And then also in productivity hours, when I say productivity, I mean when we're kind of like wasting time. We found that in the institutionalized setting, it can be a matter of 2 to 3 hours of savings a day. But in a non-institutionalized setting, when there's a lot of different like paperwork to do or PDFs, and there's not really a system involved, those coordinators can save like 8 hours a day. So it's pretty significant.
Yeah, that's huge. That's absolutely huge. Especially you're running that hospital, and making the money's great, but just being able to save 14 million is a pretty good start.
Right.
Wow. Okay. Amazing. I love that. And that's, I imagine then that's probably part of your pitch then when you're saying this to these hospitals. This is what you're kind of like.
Absolutely. I mean, like I said, it's a human in the loop technology. It's there to empower the human. So it's not created to replace or anything. It's created to empower the human, because if you can imagine a care coordinator seeing 25, 35 patients a day and having to coordinate that care, 100 discharges a day from a hospital system. And they have to find different unique avenues for these patients based off their insurance, their location, the family, the preferences. Exactly. It's a lot of work. So in order to do the quality care, the high level licensure care, you simply need a tool. And we're here to provide that.
Amazing. I love that. So I'm thinking like everyone watching this knows ChatGPT. They know the things that you can start to do with that kind of stuff. So I think when you look at this through that lens, you start to really appreciate and realize that, wow, to have that kind of assistance in my day-to-day work as a coordinator is huge.
Yes.
I love that. I love that so much. Okay. Tell me a little bit about Lightship. The experience with Lightship. Tell me what that's been like.
Oh, it's been great. Lightship has been able to help us. They sent us through Launchpad. Launchpad was a really good experience to really hone in on exactly what the problem we were solving, how to execute it as a team. That's what I really got out of it. And I love that so much. I also understood like how investors think, which has been very helpful and positive. So now I can say those ROIs off the top of my head. And if crunching numbers, because, with my team, I want them to be successful. I want our company to be successful, but I'm very focused on our team and the talents that our team has and what the gaps are and how to move that forward. So understanding what gaps there is and try to figure out how to get to that financially. They told me how to do that. Also to be very confident, knowing that my tool is something that is an opportunity. It's an opportunity for health systems to accelerate, especially now. It's an opportunity for health systems to accelerate, to make money, to be more productive by using one tool that can replace 3 to 4 systems. It can take down time for your IT burden, that maintaining those systems that they have to maintain, and take these coordinators, like I said, from the nurse to the community health worker out of silos, and so they can start working vertically. So it's taught me how to know that our solution is just like, oh, can you please try it, versus no, this is an opportunity for you to accelerate your health system to make money, but also build quality of life for your patients, and also standardize your care coordination processes for your coordinators.
Yeah, I know. I love that. I think what's resonating with me the most is that what you're doing is, the solution impacts so many different stakeholders. It's not just the coordinator. We're talking about the hospital, but we're also talking about the patients as well, the impact for them in terms of the quality of care that they receive.
Absolutely.
Is huge, right? I imagine for you that as you say, right, talking about that pitch.
Absolutely. Yes.
What we're doing helps everyone. Do you want to make
Absolutely.
more money? Do you want to save money? Do you want to provide a better level of care to your patients? Do you want to have a better reputation? Do you want to have more people coming to you? Blah, 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 blah. Well, then let's talk. Why aren't we? Why are you not doing this? You should be doing this. You should have been doing this last week. Come on, let's get you on board and let's get you going with this.
Absolutely.
How are you feeling at the minute? Because I'm excited for you, but I'm obviously no skin in the game. How are you feeling right now?
I feel great. I feel great. I feel so great. I'm so happy that we were able to put this together. I did a lot of research before we had the money to build the platform, and just to see the policy aligning with the software and how it's all going to come together just perfectly, so that you don't have to piece things together anymore. It's all one. So that is amazing. The way artificial intelligence plays on the different actors in healthcare. That is also a wonderful thing to see. Another thing I'm excited about is my family. I feel like we're going to get out of the reputation or out of the perpetual cycle or systematic disablement of someone in the family always continuously needing care and not being able to get everything they need. I feel really good about that. Actually, one of my family members had a hospitalization this week, and I've seen firsthand how Reassist could have helped with XYZ much quicker. And it just validates that all this hard work, everything's aligning up. And what it makes me feel like is, every story, every person that I touched, and I was automatically able to help them just off the top of my brain of the things that I knew, because I've been a care coordinator all my life, literally since 4 years old. Could you imagine all the things that I know that people would have to go to school for and research for years? Like, I know it as a second nature, right? So to put something like that in a technology that can be duplicative, or that can be put that in a software so it could be like a standard, I guess, if you will, for individuals that never experienced these things or don't know the resources in their area or in another county and everything's totally different, to get them quicker answers so they can get their patients what they need quicker. That's what makes me feel wonderful. And I love it, love it, love it. I know it's going to be such a great thing for, again, family members, such a great thing for health systems. It's going to be a really good thing. So I just feel like we're totally aligned, but we're continuously listening to the customer. And we're trying to make this thing it's very complicated, as you can tell. And we're just trying to make it as intuitive as it can possibly be. But my goal is that we are doing what we need to do for the health systems and for the patients.
What's particularly exciting is the potential for this to become a mark of quality. So for me, me trying to figure out where I'm going to go, I've got trigger finger. I need to go to the hospital. I need to have surgery, whatever.
Yeah.
But figuring out where am I going to go? Where am I going to go and get the help that I need? Mm-hmm. I'm imagining like a little blue tick that's like Reassist enabled or whatever it is. It's like, we are using this. One gets to a point where people are like asking, like, are you using this? Because I want to make sure that I'm getting the best care possible.
Yes.
I don't know, that feels exciting to me. When you get to that point where you can you're going into pitches and you're like, this is Ashley. This is what she's done. This is what she's gone through. This is her story. This is how Reassist actually changed her trajectory, where she was going in life with such poor care. And now, boom, this is here making sure that she's perfect, back up to strength, Yeah. The opportunity for storytelling is absolutely huge there. So, and then you mentioned, family member going into hospital, and you're thinking, if you were using this would be completely different.
Absolutely. Just looking at those data points, though. I mean, if it comes down to, let's say we got 1,000 customers and we put them all in a cohort or something like that, or let's say we, do some kind of study with an SBIR, NIH, or something like that. What I would like to study is I'd like to see what the communication looks like. So what our AI algorithm does is it summarizes the entire chart. So when clinicians are coming on, they can see exactly what happened with the patient before, so they don't have to go through a scavenger hunt through the electronic health record, which takes a lot of time, a lot of time reading and researching. I would like to know what it does for communication with the team. I'd like to also know if hospitals and healthcare systems are receiving increased revenue, if they're decreasing their productivity when it comes to wasted time, not the higher level things, but the lower level, looking for a phone number for 2 hours. Like, are we reducing that time? And then finally, what I'd like to do is look at the readmission rates, for those vulnerable patients, typically like dually eligible. They have Medicare, Medicaid insurance. They have several chronic illnesses. They go through the complete care journey from acute care through ambulatory, through post-acute, through, all that. Are those patients readmitting, or because we're looking at social, we're looking at the medical part of it, are they actually thriving in the community and able to attend primary care appointments and follow-ups? So those are some data points that I'd love to look at.
Oh my goodness. How exciting for you when you start getting that kind of data coming in.
Yeah.
Because again, it will help you obviously adjust the product. Where do I need to change it? Where do I need to make improvements?
Absolutely.
But also just that positive feedback. You're going to get people saying, I spent 2 hours looking for a phone number.
Yeah.
I ended up being a bit beside myself because I had so much time at the end of the day and I didn't really know what to do with myself. That kind of stuff.
Absolutely.
I'm sure is coming. And I look forward to following the story a little bit more. So you mentioned the long sales cycle.
Yes.
What and obviously the cost to keep yourself going as you're kind of like working through that long sales cycle.
Mm-hmm.
So final question: what do you need now? Like, are you looking for more investors? More
Absolutely,
what do you need
yeah.
right now?
Absolutely. So we are looking at investment. We are looking at different opportunities like a SAFE or a convertible note. We need to raise a $1.5 million in the next year to actually bring on the customers that are in our pipeline. We have several in our pipeline, just really close to signing. And we also just need a little bit more funding when it comes to bringing on teams. So as far as sales, marketing goes, we want to start to pay some of our C-suite team that we have. We also need a nurse that also can sell, so like a clinical liaison type of role. We're also looking at hiring a data scientist. We've been relying a lot on researchers and things like that across many universities, but we would like to bring one in-house because we think it's something that would be helpful so we can make this very, very easy and intuitive as we begin to grow and bring on more customers and learn more. Let me see what else we're looking for. So essentially what we're looking to do is just bring on enough personnel so that we can bring on the customers that we have. That's what we're looking for the money for. That'll let us go for 12 months.
Yeah. I love that. It's go time. It's time to expand.
Absolutely. It is.
Employing people. Like, this is the thing that we love about entrepreneurship. People going out there, starting businesses, doing well, hiring people, bringing out back wealth to local communities. This is what it's about. And this is why we should be supporting entrepreneurs as much as we can. So, okay. So hopefully we're going to have some investors watching this that are going to want to get in touch.
Absolutely. Yep.
I would love that. That would be a good story.
We've got several things coming down the pipeline. So yes.
Yes, love it. Okay. Well, Ashley, thank you so much for joining us. It's been an absolute pleasure. I can't wait to see where this story goes.
Okay. Thank you so much.